Hi friends, today we will discuss about the ideal female pelvis. Okay, so how we can say that the female pelvis is ideal and it is very supportive for normal delivery. So assessment of the pelvis adequacy. Examination of the pelvis before labor does not accurately discriminate between those who will achieve vaginal birth and those who will not. Even computed tomography, CT scan, or magnetic resonance imaging, MRI scanning, together with ultrasound of the fetal head is not helpful. So, why they said that the examination of the pelvis during by using the computed tomography method or MRI scanning or ultrasound is not helpful because you know what, during the end stage or the time of delivery, the component of the pelvic bone or the component of the female pelvis, that the bone and the muscles and the fibrous cartilage, and they become smooth and flexible, and the diameters become little bit increases, and the pelvic cavity sizes become little bit increase, and this is a positive feedback for the delivery. And the second point is that the fetus head that become into the molting stage, and that the bone of the parietal bone, the frontal bone, the upper lip, okay, at the anterior frontally, so they help in squeezing the size of the fetal head so it can easily pass through the birth canal. So they said that this is because of the dynamic nature of labor. When the head molds, reducing the head circumference by few centimeters, and the joints of the pelvis can move, increasing the pelvic dimensions slightly. So this is a positive feedback or a very important mechanism for the delivery. So what are the features of the female pelvis? So the first, that the female pelvis should be oval brim, or we can say that the inlet that should be in oval shape, shallow cavity, non-prominent ischial spine. As I said that in my previous video, that the ischial spine, they are the lateral borders of the pathway of the one of the plane of the pelvic cavity. Okay, and it has a very great importance because those type of female pelvis where the ischial spine, they are projected inside inwardly, they cause the fixation or the difficulty in delivery, because the fetal head, they fix and between the two joints, between the two bones of the ischium, that the ischial spines. So for the ideal female pelvis, the ischial spine should not be more prominent inwardly. So non-prominent ischial spine is perfect feature, is very helpful for the delivery. Another point, that is the curved sacrum with a large sciatic notch more than 90 degree. So curved sacrum is also very important for the delivery. And number 5, that is the sacrospinous ligament. It should be more than 3.5 centimeter long. Around it, subpubic arch more than 90 degree. Okay, and intertuberous distance of at least 10 centimeter. So intertuberous distance, that is the distance between the ischial tubercles, and the diameter should be 10 centimeter, and the diagonal conjugate diameters of at least 12 centimeter. So if all these features are present in a pelvis, then we can say that this lady is going to give a normal birth But in that condition, if the fetal size is not so big, or the fetus should not having some sort of fetal abnormalities like oligohydramnios, or we can say macrosomnia, or we can say in hydrocephalus. Okay, so if the fetal size is normal, and then this pelvis is very good for the delivery. Thank you.